So let's look at the overall numbers of South Asia as we plunge into this roundtable. Confirmed cases of COVID-19 in South Asia, remember, in India, over 50 lakhs, that's over 5 million. Pakistan, 3 lakhs, 3,089. Bangladesh, 3 lakh, 41,056. Sri Lanka, just 3,271. Nepal, much higher, 56,788. Active cases of COVID-19 at the moment, India is close to 10 lakhs, close to a million. Pakistan, just 5,936. Bangladesh, higher, 90,660. Sri Lanka, just 242. And Nepal, 15,779. Then when we look at the COVID average daily cases, India is about averaging 92,000. Pakistan, just 559. Bangladesh, 1,710. Sri Lanka, just 20. Nepal, 1,156. Let's go straight then into our talking point. Let's go straight first to Sri Lanka. I want to come to my Sri Lankan guest because clearly at the moment, sir, Sri Lanka is the outlier, Dr. Anil Jaisingh. Jaisingh, it seems to me that you have done something that no other country has done. What is Sri Lanka's magic formula?
Yeah, thank you very much for inviting. They're saying that early bird catches the worm. And we are one of the flagship holders in this business. And also we have put into practice a very strong control system from the very beginning. Actually, it was 23rd January, only we established the National Action Committee against COVID-19. And basically, the reasons for strong control were a strong public health system, which is time-tested and proven again and again. And then strong political leadership, no-nonsense approach when it comes to actions. And we launched, employed the strong quarantine measures.
Dr. Jaisingh, did you have a long lockdown? Did you have an extended lockdown?
Yes, several months actually lockdown under curfew, right? Entire country. And then thereafter, of course, it was lifted and there was night curfew for some time. And actually right now, we have no restrictions whatsoever.
So you're saying the secret is that you started early. Am I correct? That you all started early. You started planning in January.
Early, and then we took strong measures, right. And we have very strong the Quarantine and Disease Prevention Act, which was enacted way now in 1897.
Okay.
And the lockdown quarantine measures all were taken, using this ordinance. The powers were vested with the Director General of Health Services.
Let me try and go to each of you and get time right at the outset. Just get preliminary remarks. Sri Lanka, as I said, outlier. We are being told they started early, preparing early. Let me turn to Pakistan for a moment, because Pakistan is again a country which, at least in terms of figures, seems to be doing remarkably. You seem to be at the moment adding active cases just 5,936. Now there are two views to this, Dr. Zafar Mirza. One, that the Pakistani authorities are not coming out with the full picture of COVID. The other is, as the WHO says, you are a bit of an outlier. What have you done? What has Pakistan done right? Okay, we'll try and get the audio back to our guests from Pakistan. We are struggling with the audio there. Let me turn to Bangladesh for a moment. Professor Mamun Al-Mehtab, Bangladesh still 90,660 active cases. How successful or otherwise have you been? 4 months ago when we spoke, you seemed reasonably in control of the situation. Is the situation under control at the moment, sir?
It is yes and no. Yes, in the sense that, see, in March, April, it was predicted that around 2 million Bangladeshis will die from COVID, and that there will be extreme scarcity of ventilator beds, and people will be and that people will be having problems with, hospital beds, etc., etc. But as of today, as we see, as I talk to you, around 70% COVID dedicated beds of the country remain vacant, and also we see that the COVID ICUs are available, unlike in many countries in the region and beyond. And the mortality from COVID in this country now varies from 1.2 to 1.3% roughly, which is also in the lower side compared to anywhere in the world.
Okay.
But if you see the reported number of cases, it is true that we had seen a decline over the last few weeks. It was steady for between 20 to 25% in the first for the last several months, at least 2 months. But for the last few weeks, we are seeing it declined to 15%, 14-15%. So it is a bit of relief, but we cannot say that we have controlled it yet, because we all know that if it is more than 5%, we cannot be satisfied or we cannot relax.
Okay, so yes, you're saying you've achieved some progress, but you're still not fully quite there. Let me turn to Pakistan for a moment, because again, as I said, it's a bit of an outlier. Dr. Zafar Mirza, what has Pakistan done right or wrong? Is it fudging figures, or do you believe this is a reflection of Pakistan getting its act together?
Well, when WHO included Pakistan among 7 countries from where the world can learn how to deal with the next phase of the global pandemic, they looked at all the figures. So there is no question of fudging, or there's no question of lack of any transparency. I have been involved from the beginning in the response. And one thing that we have ensured from the beginning is that there should be absolute transparency of all figures and numbers. Like my friend from Sri Lanka was saying, we started earlier. There is a consistency of approach. And there has been a huge national coordination effort, which is not easy in our countries, especially as a federation. But this time, I think we put our act together. And despite difficulties, we have been able to bring all the provinces on the same page. And there was a national response to the national emergency. And also, we moved quickly from few generalized lockdowns to smart lockdowns, which means that where you find the concentration of cases, you lock down those areas so that the rest of the economic activity can continue. And as a result of this, we received a lot of cooperation from the people. So the compliance of our SOPs and for our cautionary messages have been tremendously positive this time in Pakistan. And so this is not just we are portraying it like this, but actually our hospitals are empty and people are not turning out for testing. Sometimes we are criticized that why you are doing less testing. That, well, there are no people who are coming for testing because there are no complaints.
Let me stop you for a moment. I'll come back to more from you, because it's interesting again that there seems to be a template across South Asia. And it's a familiar template across the world of tracing, of testing, and then isolating. Some countries seem to be more successful than others. Therefore, Dr. Giridhar Babu, you're hearing from our neighbors, they seem to be doing better than us purely in terms of numbers. Is there something we could have learned from them, or do you believe India's sheer size makes it far more difficult in a way to manage a COVID pandemic compared to a Sri Lanka, a Pakistan, or dare I say a Nepal, to which I'll come in a moment?
Thanks, Rajdeep, for having me. We not only share ocean, but we are also in the same kind of ship when it comes to neighboring countries. And we need to look at not the absolute numbers, but actually in terms of what is the number of cases per million, what are the deaths per million. When we look at that, and there are 2 filters we need to definitely adopt here. There is no vaccine, we all know that. Every region is susceptible to transmission, we know that. Therefore, if you find for the infection, you will find the cases. So therefore, there is no island of immunity in one country versus other. Therefore, we need to, as you clearly said right in the beginning, we need to test, track, and isolate as early as possible. The only country which has done in 5 digits in terms of cases per million is Maldives. This is followed by India, which is 3,629 cases per million, which is followed by Bangladesh and Nepal. So in terms of cases per million, that is the first requisite for every country to have. Once you have identified the areas of transmission, the next and the most important goal is to reduce the deaths. And therefore, death per million becomes the next important indicator. You have seen, Rajdeep, even within the country, there are states that have higher transmission because they report well. There are states where we say lower cases because they do not report well. So number of cases is a function of reporting and testing. We need to be very careful and not go by absolute numbers, but make sure that we find for areas of circulation wherever it is
but
present.
Dr. Babu, why is it then Pakistan, both in cases per million as well as in cases being reported is much less than us, even per million at the moment?
Yeah, so when you find fewer cases, I'm not just taking Pakistan's example here. When the number of tests done are few, when number of cases are also few, therefore cases per million is going to be much lesser than what it is. We need to find as many cases as possible. Rajdeep, we know more than 40% are asymptomatic. And then the symptomatic will have to go by syndrome-based approach. And most people, by doing active case search, will be able to find it. I can give you with assurance, there is no country in this world which can be immune from having cases.
Right.
Having areas of transmission is absolute prerequisite. If we don't have, either the country is in the early stage of the transmission, or we are not testing enough, or we are not finding enough cases.
I'll come to those numbers in a moment. You've raised two critical points. One is a mortality rate and one is testing. Before I come to you, Dr. Khem Bahadur Karki from Nepal, sir, I just want to put these numbers up. Deaths due to COVID-19 in South Asia. India has 82,066 deaths as of today. Pakistan has 6,393. Bangladesh has 4,802. Sri Lanka has 13. Nepal has 371. This is as of yesterday, 15th of September. COVID death rate. India's death rate, and this is a critical figure, 1.63%. Pakistan is more, 2.11%. So this is where Pakistan perhaps has to look very carefully at those numbers. Bangladesh is 1.41%. Sri Lanka is just 0.40%. And Nepal is 0.6%. So this is a critical number. I want to come to you, Dr. Khem Bahadur Karki. How do you describe the situation in Nepal at the moment, sir?
These days, we are getting more cases as you see. In the beginning, we have only the imported cases from abroad or from the India who came to Nepal. But these days, we are getting the cases from the communities. Still, we are in the cluster of cases, or we don't have the whole community transmission because we have.
So your curve has not flattened. Your curve has not flattened. Am I correct? Your curve has still not flattened.
Yes, not flattened, but it's going to be flattened. It's decreasing in the train like. We have a decrease in case fatality ratio also, and the cases, if you look at the cases, numbers is increasing, but if you see the infectivity rate, it's decreasing. So maybe this is we are getting the waves. The first waves we have got from these imported cases, and then now we are getting another wave like from the local cases, and we are thinking that this is the peak of the second wave, and might be.
But you're saying, but I just want to stop you because I want to look at each of you in terms of the mortality rate. Let's look at that because Dr. Giridhar Babu said that's the rate to look at. Let us start this time with Pakistan. Pakistan, sir, the rate, Dr. Zafar Mirza, is 2.11%. Should that worry Pakistanis? The fact that your death rate is higher, deaths due to COVID 6,393. Should that worry you at all?
Well, yes. The thing is that any death is worrying, and it is when we talk about the case fatality rate, what we are discussing here is in relative terms. So there are countries which have much higher death rate, and there are countries which have less. There are multiple factors which are responsible for this. We are closely looking at it. Yes, it worries us, but also I want to mention this that earlier the point was made about testing. The thing is that in mid-June, our 25,000 daily tests were revealing around about 20 to 23% positivity ratio, and now it is 2 or 1 less than 2%. So the transmission of the disease has reduced remarkably, and that is what is very important. For the rest, the case fatality rate, the number of patients turning up in hospitals, requiring oxygen, etc. There are multiple factors at play for this. So my answer is yes, it worries us, but the overall situation definitely in Pakistan is improving. It has improved remarkably well.
On the other hand, let's look at those testing numbers also. I'll put up those graphics also. India has tested 5 crore 94 lakh 29,115. That's India's tests so far. Pakistan is testing has tested about 30 lakhs 24,987. Bangladesh has tested 17 lakhs 56,746. Sri Lanka has tested 2 lakh 59,778. Nepal has tested, interestingly, 8 lakh 61,780, so more than Sri Lanka. COVID-19 test positivity rate. India is at 8.45%. Pakistan 10.02%. Bangladesh 19.41%. So that may be something Bangladesh has to look at. Sri Lanka at the moment is 1.26%. Nepal is 2.56%. Dr. Girdhar Babu, put these numbers in perspective for us. From an Indian perspective, before I go to my other panelists, where does India stand in terms of testing? We're still well below the US's and the Brazils in testing per million, but our case fatality rate at the moment seems relatively low.
Yeah, so in terms of testing, India has increased the testing capacity significantly. As a result, we are seeing nearly 42,977 tests per million in India. The only two countries in the SAARC region which do better than India are Maldives and also Bhutan, which are in definitely in 100,000 and above. When you look at the other nations in the SAARC region, their test per million population is far below. And Rajdeep, it's very important that you showed the test positivity. When you have fewer tests done, and we are saying fewer cases are there, but if test positivity is higher, that means that doesn't give any evidence that the circulation is slowing down. It only means that we are not testing enough, we are not finding active cases enough. And this is a lesson for all of us to learn from each other and even the states within the country to look at all these things in perspective. Cases per million, how many tests are we doing, what is the test positivity rate, finally, what is the death per million. When we put all four together, we have to improve from what we are doing as a region. 20% of the entire world's cases are here, 10% of the deaths are here. We want to prevent further casualties. In order to do that, the only way to do is active finding of cases by increased testing and reducing the test positivity to less than 5% as per the WHO's recommendation.
Let's look at that test positivity. Only Sri Lanka at the moment is below that 5% mark. Bangladesh, Professor Mehmul Al-Matab, is at 19.41%. Should that worry you? You're almost 20% in your COVID test positivity rate.
Thanks again. It is surely worrying, but let me tell you something. I am a very simple man, a simple clinician, and at the end of the day, when you talk about all these numbers, I get confused. When I get connected to this type of shows, I get very confused at the end of the day. I agree with Dr. Babu. The end of the day, I have to see how many persons I am saving. So 19% is, of course, a matter of worry, and we have to cut it down. But the fact of the matter remains that you can never do it in such crowded countries like Bangladesh, India, where you have such huge population. You see, one test in Bangladesh costs 3,500 Bangladesh takas. So if I want to do 100,000 tests per day in Bangladesh, I'll be spending 34 crore Bangladesh takas. If I spend 34 crore Bangladesh takas for the testing only, then how am I supposed to, my government is supposed to keep the country going? We have to remember that this year we faced a category 10 cyclone like Amphan. We have had the longest standing flooding of the century, but still then Bangladesh has achieved a growth rate of 5%, which is unlike many other countries of the world. Here, no single person has died from hunger. And we have a death rate of 1.3% in our COVID beds. That is where we see success. And my issue is that you can test in millions, you can test in thousands, hundreds, but end of the day, you have to save people. And
so you're saying your critical number, therefore, Professor, is in terms of deaths due to COVID, which in Bangladesh officially is 4,802 at the moment. I just want to come for a moment to Sri Lanka, because COVID-19 death rate here is very low. And again, the fact is that you have successfully managed in a way to control the spread. What is it? I come back to it. Is it the relatively less dense population? In testing terms, you're not very high there, Dr. Jaisingh. But the sense I get is you seem to have got your act together in terms of preventing the spread.
Yeah. The Sri Lanka is basically highly densely populated country. Now, we have the population of Australia, right? You know the size difference. And then when it comes to PCR, actually, if you have social transmission in this in your country, you can get into street and do PCR. Now, in our case, we have never had social transmission in this country. So therefore, we have gone for targeted PCR testing, especially taking the tests from vulnerable groups. And when you take tests from vulnerable groups, the tendency is that you get a higher positivity rate. Even in such a situation, our positivity rate is well below 1.2%. So we are still continuing. And also, I have to tell you, out of 3,271 cases, around 1,000 cases are repatriated Sri Lankans from various countries who work there. So therefore, 1,000 cases actually go from Sri Lanka. So we actually, currently, if you take last several months, we get cases only from repatriated passengers, not in the, so in Sri Lanka, we don't have virus right now. Of course, we have to maintain, because the airports are still closed, other than for repatriated the Sri Lankans, the airports are closed, but we will have to manage this situation so that we have good results in future as well.
Very interesting, though, that, you know, Sri Lanka is the country everyone is saying if you want to go on a holiday, that's the country to go, because they are opening up faster, and I'll come to opening up in a moment. But recovered cases, I want to put some numbers on recovered cases of COVID-19 in South Asia. India, recovery rates are climbing around 77% at the moment, 78.53 in fact, with a total number of cases of about 39,42,360 recovered cases. Pakistan, 2,90,760 cases recovered. Recovery rate 95.93 is what the Pakistanis are claiming. Bangladesh, 2,45,594. Sri Lanka, 3,016 recovered cases. Nepal, 40,638. So Nepal doing reasonably well, 71.5% recovery rate. Sri Lanka again up 92.2. So Sri Lanka on every parameter is the standout country, but Pakistan also recovery rate 95.93%. Something seems to have happened in Pakistan. Dr. Zafar Mirza, 4 months ago when we spoke, there was a concern that Pakistan could, you know, really slide in COVID times. In the last 1 month, with WHO also saying that you are a recommended model, something seems to have happened. Again, I come back to it. How is recovery so good?
Well, before that, Rajdeep, if you allow me, I want to mention and want to make a comment about Sri Lanka. What we are not mentioning here is that ultimately a national response to an epidemic is a function of its existing socioeconomic conditions, its political system, and its existing healthcare system. In Sri Lanka, among all the South Asian countries, we have the best primary healthcare system. They have the most expanded and working disease surveillance system. And I was actually talking with the previous Director General of Sri Lanka the day, and he was telling me that early warning symptoms are captured immediately and instantly communicated, and policy decisions are made. I think what we also must be stressing at this point in South Asia is that how we have dealt with our health sectors, how much we have spent in our health sector, and how we have especially looked at our primary healthcare strengthening. When the primary healthcare is weak, the response will be weak because disease surveillance will be weak. So instead of getting bogged down with the numbers and trying to
How much
compare
can I just for a moment just ask my Sri Lankan guest? Can I just, Dr. Mirza, you've raised a very important point. Let me ask Dr. Jaisingh, how much of your budget do you spend on health, primary health?
Yeah, actually, it's about if you take out of GDP, we spend about 2 to 3%. It varies
On
right?
just primary health.
And out of course, the health budget. The thing is now we have a well-established primary healthcare system, so we don't need to sort of pump a lot of resources on a yearly basis because it is historical.
Let me therefore
take
that to Dr. Giridhar Babu.
We spend about 20% of our budget on primary health care.
Very interesting. Dr. Giridhar Babu, is there a lesson there? Is Sri Lanka offering a lesson to us there? That the more you invest in primary health, and we are seeing it even in Indian states, the states that have invested much higher over the years in primary health are in a better position to combat COVID.
Yeah, so I think that is the underlying message. Primary healthcare has to be strengthened in every country and every state. And the proportion of GDP that goes for primary healthcare and even preventive services, most of the determinants of health are beyond the health department, Rajdeep. For example, good education, access to safe water, nutrition, these are beyond the health department. So therefore, determinants of health also have to get a greater proportion of the GDP. Only then countries will be having resilient system. And I also agree with our Pakistan counterpart where he said early warning system is most important. Strong surveillance system is important. And this is all part of primary healthcare strengthening. And every country should dedicate resources towards this.
But, Dr. Mirza, very quickly, how much does Pakistan invest in primary health?
Well, we do not spend as much as we must be spending. General spending on health is low, and the proportion which is going on primary health care is even lower. But that is not to say that still a response cannot be generated effectively, which we proved this time. But we are also using this opportunity very seriously in our planning processes, in our policy making processes, that on two things. One, that how we need to rethink and reimagine about our healthcare system, and especially by putting primary healthcare at the center in the context of universal health coverage. And secondly, COVID-19 has also brought home the importance and also the possibility of intersectoral collaboration that one of our colleagues was just mentioning, that it is not, nutrition is not in the realm of health, water sanitation is not in the realm of health, but in COVID-19 national effort in all countries, not just in Pakistan, all ministries have worked together.
Let me get responses. Let me get.
As well as,
I don't want the smaller. I don't want my smaller neighbors to get left out. Dr. Khem Bahadur Kharki, consultant to Minister of Health, Nepal. Has Nepal learned that lesson that you need to invest much more in primary health?
Yes, absolutely. When we develop primary health care, or we will definitely be in position to prevent or contain this kind of epidemic. So we are also we are also implementing the activities on this level, and then we have also prioritize this primary healthcare.
I think that is the one big lesson that's coming. Professor Mamul Mehtab, Bangladesh was known to be a country that in recent times was making a lot of progress on primary health. Has the COVID-19 effort strengthened that primary healthcare system in Bangladesh?
Let me give you some food for your thoughts. I agree that we have to invest more in primary healthcare. Before COVID-19, I would very proudly say that we have the strongest primary healthcare network in the world. We have community clinics for every 6,000 Bangladeshi population. There's a small primary healthcare facility in every remote corner of the country. But the unfortunate fact today remains that 19% is the diagnosis rate of COVID-19 in Bangladesh today. This means that health awareness is very important. People have to be made aware. Only making the health services available won't serve your cause. We still see that people are reluctant to wear masks in the country. So having a very strong primary healthcare network will settle the cause unless people are aware. Number one. Number two, the discussion that we're missing, I think, is why people are not dying in our countries. This is because of the excellent services that our physicians are now providing through telemedicine or whatever you say. Initially in Bangladesh, we have seen that when someone got infected or got a positive report, he or she would rush to the hospital. Now what we see is he and she runs to the cell phone and finds out a physician and gets the treatment at home. For example, let me give you my example. When I got infected with my wife and my 14-year-old child, we got treated at home. We received injection, anaxaparin and everything, and we never thought of going to a hospital.
Do we have better, let me ask you this, do we have better doctors? As a father of a young doctor here in India, I want to ask you this. Do we have better doctors in South Asia than they have in the West, Professor Mahmood?
We have aggressive physicians who adapt very quickly to the situation. Today, we are seeing, initially we saw that non-COVID cases were not getting treated in hospitals. Today, we see that no one is refused a hospital admission. That does not mean that over 4 months we have made enormous progress in hospital management. That means that our physicians are not afraid of COVID, non-COVID anymore. They are aggressively treating at home, from home, in the hospital, whatever you say. So I don't say we are better physicians, we say that we are more aggressive physicians. Another thing I like to add that if COVID had come to Bangladesh from China, the disaster would have been worse. It came via Italy to Bangladesh. We got 3 months' time. We got to know the pathogenesis, how to treat. So we are treating better. And I think that is a big case or a big cause in all the South Asian countries. We got a 3 months hiatus period to prepare to fight the COVID, and we learned better that ventilator is not the solution. The solution runs in high flow nasal cannula. We have to use judicious, simple steroids, simple antibiotics that can help lives, save lives.
Dr. Giridhar Babu, I was reading today Dr. Bill Gates, not doctor, but Bill Gates suggesting that if vaccines, for example, have to be effective, India is the place where where you will really see the push for the vaccine as well. Is there a sense that, yes, while our health infrastructure may not be robust enough, the quality of health workers, the quality of our physicians, certainly, especially in the metros, as well as just our expertise at building, at vaccine manufacturing, could still help us in the long run? What is the reason? At the end of the day, we seem to have done much better than most people had forecast. South Asia itself. This is a region with some of the poorest people in the world, densely populated. Given that, would you say we've done better than what was expected 5 months ago?
Yeah, Rajdeep, there are multiple factors, and I agree that we have definitely the most energetic and also very innovative healthcare workers. Salutes to them. But at the same time, if we do not strengthen our systems, we are putting them at higher risk. And this pandemic will come and go. In the days to come, we need to build resilient systems in terms of early warning and strong surveillance system. Coming back to your question on why is the region doing well? It's not just that the gods are with the region, but most important is the young age of the entire South Asian region. I was looking at the mean age of each countries. I think 24, 22, 26, this is the average age of citizen of each of these countries. And as you know, young people do well even when they're infected with COVID-19. But that doesn't mean that people with comorbidities won't succumb, elderly won't succumb. So therefore, we should not think that it is already a success story and forget about them. I think we need to finish the story and at the same time, start building our systems for future.
Let me ask a final question to you, Dr. Zafar Mirza. Will a day come when we'll have an India-Pakistan collaboration maybe on vaccine development? Why can't that happen? Why shouldn't we have India-Pakistan collaboration? And once the vaccine is developed, it should be spread to millions of people across this region.
Absolutely. Not only that we need to collaborate on, India and Pakistan should collaborate on this, but we should collaborate on all issues which we have been postponing for one reason or the other. And I don't want to get into politics, but there are many things that we need to collaborate and resolve them for the betterment on the both sides.
No, doctors need, Dr. Mirza, doctors should be above politics. Doctors should be above politics, and we should be able to combine with each other on telemedicine, on vaccine development. Surely these are areas of the future for us.
Absolutely, there is a lot to collaborate on, but things are not in isolation, unfortunately.
Right.
So there are things that we need to sort out.
Well, it would be nice to have a. It would be nice to have a SAARC. It would be nice to have a SAARC roundtable where you can collaborate on vaccine development. But a final question, Dr. Anil Jasing, am I right that Sri Lanka is the country to visit if I want to travel anywhere on Christmas, New Year? Are you opening up Sri Lanka completely?
Yeah, it's like this. Actually, we discuss and we have made our drafted our protocols, but we are still, postponing because we have big numbers of repatriated the Sri Lankans. So,
right.
In these countries, we have to get them down first. So, of course, in time to come, we will look forward to opening up, but the government will take that decision, and I'm sure there'll be ways and means and the protocols so that tourism can take place in Sri Lanka, and I'm sure
right.
the people world over would like to, tourists would like to visit Sri Lanka.
Well, I can tell you one thing.
Sri Lanka
I'm sorry.
being a safe destination.
Well, I think you seem to be at the moment opening up faster than most of the other countries, certainly of South Asia at the moment. You've been the outlier in a way, but I think in each way we can learn from each other, and that's what we've tried to do through this roundtable, get our viewers to learn what's happening in the region around us rather than remain insular. This is a moment for partnerships across the region. All my 5 guests across 5 countries, thank you so much. It's unique to have you all come together and share your thoughts and experiences. I appreciate all of you joining us. Thank you so much for joining me on the South Asian COVID table. To my friends from Kathmandu, from Pakistan, from Sri Lanka, Bangladesh, and of course, India.